Welcome to this episode of Let's Talk, where we zoom in on the practical applications of the most talked about sessions in this EAO Congress. In this session, we are talking about the impact of time on implant dentistry. My name is Gerrit Heijkoop and I'm very proud and honored to be joined by the chairs of this session. From Sweden, Björn Klinge. Björn, welcome.
Thank you so much.
Glad to have you with us. And from Turkey, one of the chairs of this Congress here in Monaco, Turker Ornekol. Welcome, Turker.
Thank you very much.
Glad to have you here with us because this was a start. The impact of time in implant dentistry, the theme of the entire Congress. Where do we begin? Because the first speaker in this Congress was actually not a dentist. How did that come about?
Oh, actually, I think it came about because since a number of years at the Congresses, we would like to kind of widen the perspective out from the narrow-minded dental perspective and even further narrow-minded implant perspective to something brings you a perspective of life at large.
Wow.
And
so you brought in Ben Moore from Switzerland, an astrophysicist.
Right. And I think that is as far away as you can get from dentistry, basically. And he gave us a perspective of eternity, basically, from the birth of the outer space, including coming to the birth of the Earth. And then from that on, he moved on to the future. What can we expect in the next billion years? Of course, it is not necessarily an over-optimistic perspective, especially considering and including the environmental issues. But just have the perspective, because when you sit there with the patient, and today it's getting faster and faster, and then think a little bit about how would you handle this in a billion years. So I think.
And what is the effect of that as a busy dentist, carving 3 days out of your diary, coming to a Congress like that? What did it do with you, Björn, when you zoom out on such a big perspective?
Actually, I have had the pleasure and privilege and opportunity to listen to Ben Moore previously, and once it was in a planetarium. And then, of course, it was a little bit easier for you to kind of get lost in outer space. But I think that it is important also I am extremely narrow-minded, otherwise when it comes to the professional parts. But I think sometimes it's good to look back a little bit and say, hey, there is something out there and something is happening beyond what we are doing. And I think that kind of clears the mind in a way that you can leave, did I lose a fraction of a millimeter here doing this procedure? And if I didn't have a healing time of this, how did it affect? There are other perspectives. And I think that is, and that is the idea of bringing it here to widen perspectives. And I think that there may be perhaps some of those participating saying, Jesus Christ, we are not here to listen to eternity's formation. And others saying, that's what I would love to hear more of at professional meetings like that, widening perspectives.
Widening perspectives, yes, Turker.
That was very interesting, and that was our aim, to find a speaker which will tell us what has happened in the past, what's happening today, and what will happen in the future. Related to your question a moment ago to Björn, what is the dentist's input, what dentists can perceive? I personally think that we should be leaving the time we are in at the moment more important than what's done in the past and what I will do in the present, in the future as well. I think we should enjoy the time that we are in at the moment. And he gave a wonderful example related to this. For sure, in certain amount of time, like maybe a million years later, all the continents move along and they contact each other, states, India, Australia, all of them, Mediterranean Sea disappears. It's all one big piece of land. That's how it will be in about maybe 1 million years later. I don't remember that.
It's so far away that it's...
we probably won't witness it.
No, most probably.
But
I don't want to witness it.
Exactly. It's a stunning example where you say, okay, so you come to a congress, you walk out of your busy clinic, now sit down and take a bigger perspective before you dive in.
Mm-hmm.
The other two speakers, they actually did talk about surgical techniques and prosthetics over time. So in the end, in the second part of the session, it gets down into dentistry. But before we dive into that, Turker, you're also chair of this Congress, one of the 3 chairs, together with Frank Swartz and Caroline Fook. What does this theme of the impact of time mean? What did you intend with this theme here for these 3 days?
Actually, it came to my mind many years ago when I went to a cafe. Having my coffee, I saw a little paper saying, time is the issue. I don't know how it was related to the coffee itself, but I took the picture of it. When I was nominated to be the chair for the Congress, I took it to, of course, I have to blend it with our profession. And this is how impact of time, at the beginning it was time is the issue, but then impact of time in implant dentistry came out. Other friends like the president of the EAO and my co-chair Frank found it very interesting, and the topic is also large enough that can contain many other subdivisions easily. So we worked on that. That was very interesting.
Exactly. I'm also thinking it could have also been time is the tissue if you're a periodontist, of course. But let's go back to the session and what you learned. Related to the other topics, which were a little bit more dentistry related. Björn, any surprising insights for you there?
Actually, now we're going to the dental sessions, the surgical and prosthetic, and starting with the surgical. I think that one so important message is trying to keep teeth prior to replacing them with implant. I mean, implant dentistry is fantastic, and I've been, on this tour for 40 plus years now, and seen how that can change lives of patients, totally change life, and the way that they are, seen and met by people outside. But also, it has moved a little bit to this is an opportunity that we might use a little often. It's also an economic issue for the profession. And
you mean, in a sense, if you're a specialized implant dentist, you want to place implants?
Yes.
Instead of preserving teeth?
Right. It may be that. And I think that one of his core conclusion was that make sure to priority number 1 is to save teeth. When that is not possible, replace with implants. I think that is something extremely important. And also,
you could say it's a daring message in the opening plenary of an implant dentistry conference.
Yes, indeed. But also, bringing the patient perspective on side, not only the professional perspective, but the patient perspective. And I also think that, when implant dentistry started for me 40 plus years ago, we had some guidelines. If it was a maxilla, it should heal 6 months. If it was a mandible, it could heal 3 months. And now it gets more and more into who is the patient in the chair? What is the healing capacity of that patient? And what are we going to achieve here? It's individually based, much more than guidelines on static,
That's an interesting word I've never heard before, and I've been to some EAO Congress. You say the healing capacity of the patient is an individual factor that people should start to consider more, because I don't think that's standard protocol. Eh?
No. And I think that's so important he brought that up. And that also came back in the prosthetic part, that perhaps we need to understand that this is a unique individual in the chair. and that has to be uniquely treated according to the capacities available there.
When you just start doing implant as a beginner dentist, it's very exciting. And in the clinic, you want to do much as possible.
Of course, because that's your learning curve.
Your
right? You get better at it.
And you're very excited. You want to do much as possible. But as the speaker, Howard Gluckman, said that the much you do, the much you respect the teeth. Because you realize that implant is not something without any problem. Implantology has problems as much as the teeth. I mean, people lose their teeth because of some problems, some pathologies, etc., etc. But you may lose the implant as well. They don't stay there forever. So, forgetting about that, you have a human sitting in front of you in the chair, trying to do much as possible is a wrong beginning approach. So those who were in the meeting room, I think they got the message that when you get more experience, you are more precautious about the technique, and you don't you keep the teeth more than you keep the implants.
And talking about more experience, I think sometimes it is how many implants did you place?
Yeah.
And
that's the criteria that you're proud of yourself.
And the next question should be, how many of these implants did you follow? And over how long time? How did they succeed? So the being able not only to place a number of implants, but having the capacity to recall the patient and do what is needed to support this patient to have this fantastic things that has been placed there with the implants. I think that is very important. It happened to me myself in another surgical procedure. I came to my mentor and I was quite, young and happy with having made hundreds of this. And he looked at me and he said, "That's very nice, Björn. You did 100 of these. And what happened to the patient?" What do you mean? Yes, at the follow-up. What did you see when you saw the patient back? It got a little bit. I was
silent.
Yes.
But I'm actually slightly surprised. Obviously, lacking clinical experience myself. But so you're saying it's not standard that a dentist or someone who placed an implant kind of follows this patient over time. It's actually a call out of this session that perhaps you should be aware and extend that relationship.
Yeah, and one of the situations may be at occasions, and that is you refer a patient to have an implant installed by a surgeon, and then the patient comes back to you, and the surgeon never sees the patient again.
Yeah. It could be an interdisciplinary case, where in this case the surgeon would also be nice if they follow up with that patient as well, besides just the treating dentist.
This fact that you do implant as much as possible also fits to our topic. Like you feel yourself a very experienced and nice surgeon. You do a surgery and you feel that you've done your best, and you do or as a prosthodontist, you feel yourself that you completed the case and a wonderful surgery. 1 year passes. You have the patient back, suddenly part of the implant is visible. Or 1 month later, your patient calls you back and you see that the implant that you think is a perfect surgery is failed. This is only shown by time. Time defines if you are successful or if you're failing. So that was one of the feelings that we had while selecting the impact of time in implant dentistry to be our topic.
Beautiful. What is currently the standard protocol of follow-up?
I think that it depends a little bit in different nations,
and clinics.
And clinics. But of course, one of the major things is to recall the patient at least at 3 months intervals initially, and then if everything is fine, you can extend this a little bit. But sometimes we thought, when they are discussing some prognosis after cancer treatment, that it's a 5-year result, and then people think, after 5 years, it's safe.
Hands off.
It's not.
No.
And the same thing is with implants. It took, I think, 7 to 8 years before we started to realizing the impact of peri-implantitis, for example. So it is extremely important. And again, it is so much that we can do, being observant of the patient, to prevent things happening also late. If we could, for example, have the patient to better understand the self-care at home, because I mean they are only shortly at the dental hygienist or at the dentist. It's what's done at home that counts really, and is important also for the long-term success of.
Challenging question to you both. What do you believe is the root cause for this not happening? Is it on the one side the patient making an economical choice? Is it the professional just focusing on placing as many implants? Or is why is this not yet everywhere the case?
I think it's not black and white. It's not either or. It's a combination of situations. But of course, economics is a big issue for many patients. Having spent...
Right, because I'm listening to you and I'm thinking, yeah, the patient sees you coming. Well, I've been to this EAO Congress. I want to follow up with you every month or every 6 years or whatever and come back into my office. Yeah.
Yeah. And of course, the learning curve is extremely important for all the staff. I've experienced when doing surgical procedures, placing implants and things like that, and telling patients things in the surgical session. And then the patient comes to the receptionist, say, I heard my doctor said something about what I should do, but I didn't quite get it. Mm-hmm. So it's important that the whole team is involved in the treatment. I mean, not the drilling per se,
no.
But
everything around it and all that is required from the patient.
Yeah,
as well,
and the
impact.
supportive.
I think it's the perception of the character of the patient as well, because you may be in a very well-leveled society, but the person may not be willing to see you for every 6 months. I have patients that I didn't see for more than 10 years. When they come back, they say, well, I don't have any problem. Why should I come back? Even if you warn them for every 6 months, it happens. It's only related to the personal. So, of course, it may be a general approach depending upon the education, social status, countries, social realities, etc., etc. But you may end up having a patient doing a full upper case and never see it for 10 years.
Yeah, and that is something, then that is the message. Let's see if as a professional here, we try to get that message out. Keep seeing your patients. Right?
Yeah, keep seeing the patient and make the patient involved.
Exactly, so they understand the importance.
Yeah, because it's so often that the patient comes, so to speak, with the teeth or mouth to the dentist and hygiene, say, fix this. And then when it's done, the implant's placed, the prosthetic placed, it's over. It's not my business. But it's like I try to be a little bit philosophical about this. I try at the best of my capacity to, it's like when you listen to some music, it touches you. You cannot tell really what happens, but it touches you. What I want to achieve is that the patient achieves my message as this is my priority. I want to do this for the best, not for the dentist, but for myself, for the future.
This is a nice quote. Björn Klinge at the EAO Congress Monaco. We need to touch our patients in the heart, right? As if we are playing music.
Yes.
Nice. I think it's a good takeaway. Final third speaker, Stefan Chu from the United States, talking about prosthetics over time. Any key insight or practical takeaway you took from that session?
Yes, I don't know if Björn will agree. The main message I took from him was that each patient is different from the other one. So we should behave each single case, not the patient itself, single case, because in one patient, you may have one implant here, one implant there, they're not the same. So we must treat each single implant case individually. I think this is something that we criticize and changing also in general medicine. Like if someone has a high blood pressure, all of them get the same medicine, and nowadays it's criticized that that shouldn't be like that. The medical care should be personalized. We can convert this message to implantology that each single implant should be treated in a way that it's a unique case. Like, for example, if we lose an implant, and if you had a question, why did you lose this implant? Torsten Yem says that there are more than 65 different reasons that you can lose an implant. And I personally never believe that one can say that, okay, I lost that implant because blah, 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 of that.
It's probably 8, 9 or 10 of those 65 reasons.
Maybe more than one. So the message that I get from that speech is that it's true for surgery as well, that we should treat all our patients individually, and one rule or one approach which can be good for one certain patient may not be true for the other patient.
Okay. I totally agree with that individualization or personalization, whatever term we use, there are...
Personalized medicine is a term heard a lot.
Yeah.
But then I want to challenge you with a final intrinsic dilemma then inside this scientific organization. The field of implantology is relatively new, originally very case-based. There's a lot of effort and push to make it science-based, make it protocolized, make it predictable across the nation. How do you see this drive for science and predictability versus the personalized case-by-case situation? There seems to be an internal conflict about that. How do you see that?
Well, there is a conflict also because science most often present mean values. And there is no patient who is a mean. They are all extremes from that side to the other side. And that is something that we absolutely have to, a message that we have to bring across, not to stay in the scientific community, but in the clinical. And then we are back to personalization or individualization. But also I think that a organization like EAO and other professional and scientific organizations, they have a responsibility to transfer the scientific message to the general dentist in this context, because there are a limited number of dentists reading the original papers in the scientific review magazines. So it has to be communicated in a way that it's digestible in the clinical context. And I think that the presentations that we had today gave a very broad perspective, but also focusing on understand that you have an individual patient on site and they will react differently, and you have to choose treatment modality according to this individual.
So you say it is true, but still read the science, and you as a professional, your professional judgment is the linking pin between that generic science and that individual case.
It's one of the tasks of EAO type organizations to standardize the procedures, like doing a consensus program, for example, that we have one led by EAO a couple of months ago. We call it GCCG. Within those consensus programs, not only EAO, of course, but some other organizations, it is tried to standardize the procedure. Of course, every individual dentist should know that whatever the standard is not good for everybody.
Exactly.
Perfectly.
But you should be aware what the starting point is.
You should know that this is the common sense, but there can be some deviations, and that's one of the tasks of EAO. I think it's doing good.
Nice. Well, you tie this very nice together, because this is actually what we're doing here, Björn. We're trying to make all that science, first in the papers with a nice Congress session, which is recorded and available in Monaco online. Then if you find 90 minutes too long, you perhaps watch this shorter segment with the chairs. And we have a similar talk like this about the session on the global consensus.
I know.
So that's all here as well. Björn, you want to make a final comment?
No, it's only, again, it's not a matter of how many patients you have treated, how many procedures you've done. How did you follow this up and how did you individualize for this specific patient? That is, I guess, the core and key message here.
That's true. I agree with Björn, and I agree with Gerrit Heijkoop. He said that teeth are more important and preservable comparing to implants. So the much I do implant, the much I preserve the teeth.
Nice. Very nice. Thank you very much,
Welcome.
Turker Ornekol, Björn Klinge, and thank you for watching. Now, hopefully, you've gotten so curious that you actually want to hear what Ben Moore, Howard Gluckman, and Stefan Chu had to say. Check out the recordings of their Plenary 1 session on Monaco online. And if you say, well, I'm more of this short-paced, faster, just reflect on what it actually means kind of talks, then make sure you click on some of the other Let's Talk episodes that we have here available for you. And final call to action to you. If you know any fellow professional out there who would benefit from the conversation we just had, make sure you forward and share the link to this video with them. Thank you for watching.